Coming up next on Being Well, Dr. Ryan Jennings from HSHS St. Anthony's Memorial Hospital will be here to talk about an important conversation you may want to have with your loved ones. We'll be discussing ways to share your final wishes for end-of-life care. While 90% of people say this conversation is important, only 27% have done so. Dr. Jennings will share his thoughts on the subject as well as a helpful online tool called the Conversation Project. Don't go away, Being Well starts right now. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. HSHS St. Anthony's Memorial Hospital, delivering healthcare close to home. From advanced surgical techniques and testing to convenient care for your family, HSHS St. Anthony's makes a difference each and every day. St. Anthony's, where you come first. Thank you for tuning in for this edition of Being Well. I'm your host, Lori Banks, and today I'm so happy to welcome a new guest to our show, Dr. Ryan Jennings from HSHS St. Anthony's Memorial Hospital. Did I get that right?
You did. Perfect.
Down in Effingham. Thanks for coming up today.
My pleasure.
Well, for our viewers who don't know you, why don't you tell us a little bit about yourself and your practice?
Sure. I'm a physician, obviously, by training. I trained as an internist and a pediatrician. I'm boarded in both internal medicine and pediatrics. I practice 13 years in private practice in Effingham, and then about a year and a half ago now moved over to the hospital and work as the full-time chief medical officer.
Okay.
And I continue to help with the hospitalist service and take care of inpatients on the hospital side, but I don't have a clinic practice anymore.
So you get to do a little more administrative work.
I do.
But you said you also work as a hospitalist. Can you explain to our viewers what a hospitalist does?
Sure. A hospitalist is a physician that's specialty is really hospital-based medicine. And so no longer having a clinic practice, an outpatient practice, they're experts in caring for patients during a stay in the hospital.
Okay.
And we're seeing more of that as doctors try to find a good work-life balance. And really as hospital medicine advances, it becomes more and more of a challenge to be an expert in both worlds. So it raises the bar.
Well, we're talking today about something we haven't actually addressed on this show, but we should have, so now is the best time to do that. And that's about end-of-life decisions, which is something that for some people they're thinking, oh, that is the last thing I want to talk about. But I know in your position, you've seen and dealt with families who've had these conversations and probably families that haven't, correct?
Absolutely. And I think your comment that people don't want to have this conversation really isn't true. When you really look at the literature and things, most people really want to have this conversation, but they don't. So when they poll Americans, about 75-80% of them will say that they'd like to have a conversation with their family around it, but only about a quarter of them have. And I think that's where the opportunity lies, is because that conversation's on the tip of the tongue. And it's just trying to find a process and a way to bring your family around the table and have that conversation.
Well, that's what we're going to address today, is how to start that conversation. And I kind of want you to walk us through the process. First of all, who should initiate the conversation?
So, in my travels, I guess, and experience, I've found a project out there through the Institute of Healthcare Improvement, the IHI, and they partnered with another not-for-profit agency called the Conversation Project. And this is really a really easy way to try to walk through that process and to begin to answer those questions of, who should be involved and how do you do it and what are the pieces of the puzzle that you need to make sure you don't forget along the way. And so, I think the most important thing to think about is these conversations are best had way before the fact that they're an emergency. Too often in the hospital, families are put in a position where a decision has to be made and they're not entirely clear on what their loved one really would have wanted at that moment in time. And so in the perfect world, you've had those conversations with your loved one and you know exactly what their expectations are surrounding their care at the end of life, because people have different expectations. For some people, the most important element is maybe being at home or being surrounded by family. For other people, they don't want to be at home. They want to be in a hospital potentially, or they don't want family around. They want to have privacy in those hours. And so having conversations around that ahead of time, conversations about how involved they want to be in those decisions towards the end of life, because I've had patients of my own that, Doc, I don't want to know anything, tell my wife or, tell my kid, but I please, just, they'll make good decisions for me and don't tell me anything I don't need to know. And I've had others that have absolute certainty that they want to have a great deal of decision making towards the end of life. But there's no way to know that unless you start the conversation. And
so how do you actually bring this up? Like, at a family dinner, or what is the what would you suggest to people?
Well, it really is something that requires some planning. Yeah, this isn't that everybody gets around the Thanksgiving table and suddenly you go, well, I want to talk about when I die.
My end of life decisions.
Yeah, my end of life. So what the Conversation Project breaks this down into kind of 4 different pretty simple, straightforward ways to think about it, and that's get ready, get set, go, and then keep on going, just like a race. And so the get ready part is what you're getting at, which is the idea of starting to think about, okay, what are things I need to take care of before I even have this conversation? And that can be pretty diverse. Sometimes there's an estranged family member that you need to deal with ahead of time. Sometimes there's peace to be made. Sometimes there's things like that. But before you can even begin to talk about how you want to be cared for, there's just other duties that need to be addressed ahead of time. And then a little bit about who needs to be at that table and be ready to have that conversation. And then it's get set, and that's really starting to think about what is most important as an individual. Even before you have the conversation, you need to know what that conversation is going to have in it, and that's asking yourself some of those hard questions about how do you see the end of your life? Where do you want that to be? Who do you want to have nearby? How aggressive in medical treatment do you want to be? Too often patients say, well, the doc will tell me when there's nothing else that he can do. And the reality is that it's so rare that there's really nothing else that we can do. There's always one more crazy thing that we can put somebody through, but is that really the way that you'd want to live your life? And so thinking those parts of the process through, so that then when you start to sit down with your actual persons that you want involved, you know what you want to share with them. So it's not a total shot from the hip. It's a very honest conversation about how you see the end of your life and what you want to do.
So this whole conversation, and you're thinking about it, and you thinking about it in your own head, takes place well before you maybe go to a lawyer and get a living will and a DNR and all that sort of stuff. That's sort of the end product of this thinking and planning conversation part.
Absolutely, and that's more the making sure that then all the legal checks and balances are in place, so that indeed nothing throws a curveball at the way you had put all this good planning into place. But I've seen many times where someone's put in place some type of advance directive or living wills, those types of things, which are really legal documents. But if you haven't had that conversation with the family member, and then you're no longer able to verbalize what you really want, it doesn't go the way you wanted it to go.
Right.
So,
you see that portrayed in a lot of TV shows and movies where maybe the kids didn't know that mom had this all, and they're shocked that she decided DNR order, and really at that point it's a legal document. The you can't do anything about it, or the kids can't.
Well, it sure gets messy.
Yeah.
Yeah, I mean, you know.
In what's already a stressful
we always try
time,
to,
too.
you know, as physicians, try to balance that. And I think, again, it's important that the concerns that the individual had spoken out ahead of time, either through a document or, you know, in hopefully one of these conversations, is what's put in the forefront. Because you know, it's you know, we talk about, it's not a conversation about what's the matter with you, it's a conversation about what matters to you, and starting to focus on what matters to someone. There's a lot of things that we can do about what's the matter with you, but a lot of times that's not the priority.
Right. So are there, should this involve the whole family, or should it involve, say you have family members and you know that maybe the sister is the one that is going to want to do everything possible to save the parent's life, and you've got maybe the more practical sibling. Do you share that information with both of them, or should you side with the one who's going to maybe side with what you really want?
Well, the goal is to have that conversation across the board. Now, how you structure that is part of the idea around the get ready. So there may be individuals that need to be involved in the decision making, but shouldn't be at the table at the same time together.
Yes.
You know, so that you can align your decision making, and then bring folks in so that you share those decisions and come to a mutual understanding. But if you don't do this ahead of time, then I guarantee you that will happen at the bedside. You know, when you're no longer able to share in the decision making.
You had talked about that this is this actually, it's a thing called the Conversation Project. Is it like a web page that there's a document that people can follow and fill out?
Absolutely.
Okay.
It's actually it's www.theconversationproject.org.
Okay.
And or just, you know, web search for the Conversation Project, and you will find it, no doubt. And yeah, they have a toolkit, and you can print it out. It has examples of things that you might consider as far as things you better think about, because not everything is as obvious as what you might think. They've got some really good things to kind of cue your mind.
Well, that's what I was going to ask. I mean, obviously, when you think about this, you're thinking about maybe like the do not resuscitate and all those sorts of things. But you said there's some things that aren't real obvious. So what are things on there that people might not have thought of?
A lot of things to cue up things around your own personal affairs.
Okay.
You know, and again, thinking about a family member. Maybe there's a family member that has a special need that you want to make sure someone's identified to take care of. Or, you know, who knows what other things are out there. Maybe you got a pet that you really want to make it crystal clear that, you know, this needs taken care of. So it's about your wishes as far as the things that are taken care of at the end of your life, more so than the nuts and bolts around what goes on at the hospital or doesn't go on at the hospital. And the way they frame it, I think, helps you to kind of keep thinking about those as you go. And so even after you have the first conversation, one of the things they say is, okay, now you sit down afterwards and go, what did I forget? Before then I take the next step, and you know, the keep going part, where now then you go have that conversation with the next person, and now you've said, oh man, I forgot something, I need to make sure I include that in this conversation. And so it's well designed.
Is this then a document that you can take to your attorney that can help you with the next steps?
It certainly could be. Yeah, it would definitely serve as a basis then for your attorney to draw up the legal documents that would support what you've said. And you know, and I think the legal piece is a necessity. There's no doubt about it. But reality most of the time is, if you've done this ahead of time, the legal piece is easy, because if the ones that are concerned about you and care about you are aware of what your goals at the end of life are, you made their job easier. You know, there's nothing better than kind of knowing, even from my own experience when my mother passed away, she had made it crystal clear what her wishes were, and Dr. Jennings didn't have any much say about what that was. And you know, things I agreed with, things I didn't agree with, but I'm not going to disagree with my mother. So if she said so, I did it. You know, it's that simple. So
I know you're a doctor and you're not an attorney, but just a couple of terms, if you could clear them up for us. You see something advance directive.
Sure.
What really is that?
So an advance directive, and there's several different kind of variations on the theme. Most recently, there's a form called the POST form, but they're all about kind of to what extent you want to use technology at the end of the life. And at one point, an advance directive was essentially the do not resuscitate idea, which was, you know, do you want to have CPR and have us give you medicine and shock you and do all that crazy stuff? But it's as technology's advanced, it's become a lot more elaborate than that, and addressing things like, do you want to have nutrition provided by some means if you're not able to do it on your own? Do you want to have hydration provided, depending upon where you're at, and some very, very specifics that allow an individual to have a tremendous amount of decision making in advance, so that somebody has that tool, and then it's developed as a legal document rather than just simply a conversation. But again, the idea is the legal document's about as good as the paper it's written on to an extent, because when disagreements begin, the family still has a tremendous burden to try to work through those if they haven't done that ahead of time.
Okay. So what about like a living will?
Similar
versus
idea,
a regular traditional will.
Yeah, similar idea around that's the idea of putting in place decision making ahead of time. That in the event that I'm no longer to make decisions for myself for whatever reason, and as we look at folks now with Alzheimer's disease and dementias of other types, having those decisions put in writing ahead of time in a living will or other types of advanced directives, again, gives the family a whole lot of comfort in knowing. This is what mom, dad, brother, sister, whatever, wanted at the end of their life. And, everybody's different. I have folks that, as long as I'm happy and having fun and able to eat, leave me alone, and other folks that, make it very, very clear about what their wishes are.
So if you go through this conversation project, do you necessarily then have to have all these legal documents to back that up? If you've had this conversation with your family and you've gone through these steps that are outlined in that website, do you need the other stuff?
It's always surprising who shows up at the 19th hour.
Okay.
That's part of that get ready. Who's out there? Who do I need to have the conversation? So I do think doing something more than just the conversation project, so that you've got it, on paper and in a legal document, that can help then in the event that something unexpected comes on the scene, which happens more than you might imagine. There's a family member that hasn't been on the scene for a long time, that lives far away.
Brother shows
the long lost brother, nephew, niece, cousin, and so having those things, the conversation critically, but then the documents to support it really make it so that it can be a very meaningful moment for the family.
Dr. Jennings, how do physicians come into play when this situation arises? Mom is in the hospital and you have all the kids around. What's their role? I mean, they provide the medical care, but do they have to sometimes referee this?
Arbitrate a little bit? Yeah, unfortunately, yes. I mean, obviously, very delicate situations, and I'm certain, speaking only as myself as a physician, but I've seen many other physicians similarly, always are trying to bring it back to, okay, what would mom or dad have wanted, or whatever the scenario is. What kind of conversations did you have before? Because even if they didn't put it on a piece of paper, a lot of folks have had that even offhanded conversation of, so you go and you draw upon that. And then we try to identify other things that maybe will help them through the grieving process. And for some folks, that's faith. And as a Catholic hospital, of course, we have lots of resources and for all faiths around bringing that to the bedside. Sometimes it's, other activities where they need to walk away for a little bit and just have some time to themselves. And so, trying not to hurry the decision making. We don't always have the luxury of time, but most of the time we do, at least to some extent. And I tend to focus a lot on let's make sure that you're spending time with the loved one, because regardless, it's very rare that you're having this conversation that it isn't inevitable. It's inevitable for all of us at some point, but whether it's going to be in the next day or the next time you're in the hospital, it's still a good conversation to have had. So, a lot of times you get the question of, should we have the relative that's at a distance, come? And my answer to that's always. You know, the worst thing that could happen out of this, I guess, is that your loved one lives and they got to spend time together.
Yeah.
You know, so I mean, it's never a bad thing. And you know, I mean, I certainly try to temper it with the actual situation. I mean, a mild illness is a different deal, but when somebody's really got a high likelihood, then that answer is always yes. You know, come to the bedside and then get those conversations done. And if they survive the hospitalization, hallelujah. And then you can have that conversation already done to some extent, so that the next time it's a little bit easier. But it is challenging, and I don't have a cookbook for it, but thankfully, usually there's some member of the family, the majority of the time, that is intimately aware of what the loved one really wanted, and trying to work our way through that and bring everybody to some peace. And
I'd imagine in the years of your practice, you've seen this go relatively well, and maybe not so well.
You do, you absolutely do. But you know, one of the things that's a little bit of a challenge for hospitalist medicine is that not having that pre-existing relationship. You know, when I was in a private practice and took care of my patients cradle to grave, you know, then I may know a lot about what their wishes were. You know, even if some family member doesn't, you know, I might have known quite a bit. And as a hospitalist, that's more challenging because you haven't had that long-standing relationship. So that's one of the things that I think, as medicine moves in that direction, we're going to get better at, and things like the Conversation Project will really help us to do that, because they'll have been that already happened with the family member.
Yeah, I mean, in the olden days, you would have had your family doctor who, like you said, knew you this whole time, and now it's more common that when you go in the hospital, your general practitioner may not even know that you're there. So it's even more important that we have this conversation. And even as you had alluded to before, medical advances in technology can draw life out a lot longer than it used to as well.
No, definitely. You know, that's a reality. And again, when patients lean on the doctor to say, "Was there nothing else?" and you're kind of going, "Well, yeah, but I wouldn't do that. No way." You know, but you know, you have to be honest. But at the end of the day, the best made plans by the patient and the family are really where we're looking for. It's what matters to you.
So I wanted to ask, when we had contacted you about being on this show, we had talked about topics, and you right away said, "I want to talk about this. I don't want to talk about diabetes," or this was really important to you. And I was curious as to why this was an important topic for you to talk about.
Really, because of the reality of how critical this is, and I think as we just kind of touched on the advancing technology, you know, we're extending people's lives in ways that maybe is not a way that they wanted their lives extended, and I've also seen so many times where without that conversation, that things don't represent the wishes of the patient at the bedside, you know, in the bed. And especially as we've expanded hospice services and things like that nationwide, we're changing the conversation around the end of life and starting to have that reality of that the end of life looks different for everybody, and it can be an incredibly wonderful experience for everybody. And if we hold true to what our goal is, which is meeting that patient's needs both physically, emotionally, spiritually, et cetera, and the families, we'll have a great outcome.
And this tool that you've mentioned is a really great way to start. Can you what was the website again?
It's theconversationproject.org.
Okay.
And I've looked at a lot of these things, and I will say this is probably the one that is just easy to use, well thought out, free.
Yeah, well, that's what's
that's
good.
a bonus.
Free.
You know, and really cues you up to start to have what's a difficult conversation. You know, talks about how to break the ice with a family member, and it's simple stuff. It's you know, I need your help on something. Nobody's going to say no to that.
Right.
They're a little surprised then what you say what it is
about,
but you know, but really just simple ideas about how to have that conversation and make it great for everybody involved.
Yeah. Well, Dr. Jennings, thanks so much for telling us about this tool and giving us all some things to think about and chew on, and a way to get started on the conversation, which, you know, if we have it now, it can make things a lot better in the end, so to speak.
Thanks for coming up to Being Well. Appreciate that.
My pleasure.
Thanks.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255.
Rediscover Paris.
Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. HSHS St. Anthony's Memorial Hospital, delivering healthcare close to home. From advanced surgical techniques and testing to convenient care for your family, HSHS St. Anthony's makes a difference each and every day. St. Anthony's, where you come first.